Autism evaluations. Oftentimes, it is very hard to get an autism evaluation. You may be put on a wait list, and we know that every day is really critical for our students and families. And if your child has support needs, you want to get started with intervention. And so today I had on a wonderful guest, Dr. Michael Perisa from Zest Pediatrics. We talk all about autism evaluations. How much does it cost? How much does an out-of-pocket autism evaluation cost? This was informative for me. And what do you get from the autism evaluation? What are the different pieces and parts? We're going to get into that information. Michael is a doctor with Zest Pediatrics, and we're going to talk about what is direct pediatric care. It is a membership-based service, and they are offering these autism evaluations in a variety of states. Zest is actually where they're located, is actually very close to where I live, but I was interested in the licensure piece for doctors. As I'm a speech therapist in BCBA, we talk about, do you have to live in Ohio? The answer is no. Two of the doctors do this in Zest, and they are licensed in a variety of different states. So if this is something that is interesting to you, I hope that you will listen to this episode with Dr. Michael Perisa. And if you like this episode and if you like the show, make sure that you visit us on Apple Podcasts and leave a review. I always love hearing from you.
You're listening to Autism Outreach Podcast, a podcast full of ready-to-use strategies to help those with autism strengthen their communication skills. Here's your host, Rose Griffin of ABA Speech, a speech therapist and board-certified behavior analyst who shares tips you can use in your next therapy session.
Welcome to the show. Today we have with us Dr. Michael Perisa. Thank you so much for joining us. Happy to have you on.
Yeah, thanks for having me. I really appreciate it.
And I learned about Zest Pediatrics. I talk about social media a lot here, Michael, because I have built my entire business by posting on LinkedIn, Instagram, and all of those things and sending emails every week. This is the world I live in. So, but you guys had popped up. I think I've been following somebody from Zest Pediatrics, and I thought it was a really interesting concept. And then you had posted about autism evaluations, which I know that a lot of people that listen to my show, we have speech therapists, BCBAs that listen, and also parents. I know that's something that there's a backlog for people that want to get evaluated. And it seemed like you were really solving a problem that's out there in the community. And so that is why I wanted to have you on the show. So thanks for coming on. I appreciate it.
Yeah, definitely.
So let's start a little bit about just what Zest Pediatrics is. It's new to me. I've seen it over and over again, like your marketing is working on LinkedIn and maybe even a Facebook ad. I'm not sure, but I'm curious. So tell our listeners and myself a little bit about Zest Pediatrics.
Yeah, so Zest Pediatrics is the first pediatric direct primary care network in the country. Direct pediatric care, direct primary care is membership-based care. So we're able to get around a lot of the headaches that traditional practices face with insurance-based repayment and care. And it's probably not a surprise to any of your listeners or yourself that unfortunately, our healthcare system is a little broken, especially for pediatrics. You're talking about these wait lists for autism evaluations. How about wait lists just to get an appointment, right? You call and make an appointment because your kid's sick. Oh, we can see you in 2 weeks. Well, they're sick right now. Like, help me out here. Or not seeing the same provider every time. So not building those relationships, having somebody evaluate your child that might not know your child, might not know some of the subtleties that exist within that. Our model and our network was designed to try and eliminate those things. So when families join our practices, they get 24/7 direct access to would be me or any of our other providers in our offices. That's texting, calling, emailing, anytime, day or night, when something comes up. I had a child a couple months back. Have you heard of a nursemaid's elbow before?
No, I don't think so.
So dad was playing with the kids, swinging their arm.
It comes out of socket?
Yep. The kids won't use their arm at all. They're screaming and crying. I think they text me at 8:30 at night. I was at their house at 9:00 while the kid was watching Encanto, was able to reduce it for them and save them $1,500 emergency room bill.
Wow.
That's just the type of care we can deliver because we don't have insurance regulations, right? We can do home visits. I don't need to bring people into the office to bill their insurance. We partner with plenty of our families, teaching them how to use at-home otoscopes, right? Those ear lookers. So when their kid has an earache, send me a picture of it, right? I don't need to bring you in to bill the insurance. I can take care of you however we best see fit without those restrictions. It's been fantastic.
Yeah, that's cool.
I was with a traditional insurance-based practice before and seeing 35, 40 kids a day during sick season and just not having time for anybody, right?
Yeah.
The doctors in the system want to do a good job. They just can't because it's,
Mm-hmm.
revenue, we need to see more patients to generate more revenue.
Yeah.
My breaking point, finally, I had a 12-year-old right at the end of their yearly checkup. They get 20 minutes to tell me everything that's going on in their life for a year. Mind boggling.
Yeah.
But they didn't fill out their depression screener. So I go and grab my papers. They're filling it out. I come back. They're off the charts, depressed, suicidal. I'm like, I need to sit down and unpack this with you for everybody's sake. But I have 3 other people waiting that needed to be seen too. And it just got to me. And I'm like, I can't do this anymore. I need something different. I need to do better for my family. So that's when I found out about Zest. And I met with Dr. Hertz, who was initially with one of the bigger health systems here. And then the rest has been just fabulous.
Oh, interesting. Okay.
Yeah.
I won't bore you, but I was watching this show that was called Royal Pains, and it was about a concierge medical doctor. It kind of seems like the same type of thing. I just finished that. I was going to a conference in Miami last week, and I was like, I finished the whole thing. But it's interesting. I mean, I think that sometimes people don't know that this exists, like that this is an option. Obviously, if money's an issue, that is hard. But I mean, it's nice to know that this is something that actually exists on the radar for people, actually for clinicians too, for doctors too, that want to be able to provide just a different level of care. And I think everybody has an aha moment. I have one, and I'm a speech therapist in BCBA, why I started my own practice, and you all have this kind of defining moment. So I think why you're doing it is really, really cool and really able to help people in a specific way. That's awesome.
And just start quickly back to that point, cost wise. So if thinking about our biggest hurdle, especially in Northeast Ohio, is why would I pay for something outside of my insurance?
Right.
And you really have to dig in with families. Like, okay, well, what does your insurance actually get you? What does it cover?
Right.
You think about co-pays for every office visit, paying for in-office testing, urgent cares, emergency room visits. This model eliminates a lot of those pain points and cost points because there's no co-pays for office visits, whether you see us once or 30 times. Oftentimes we can spare your emergency room or urgent care visits because we're available when you need us. Your kid gets cut, they need stitches, come into the office, we'll fix it up. It's huge cost savings there. And then pairing our membership with a high deductible HSA plan or FSA plan, and then having families utilize that HSA or FSA. Of our families who have joined, I'm sure we've come close to breaking even, if not save them money. And we're providing a much higher level of care too. So we get that question plenty of times. And I think as a society, we're hoping to sort of break that mold and show families that there's not just one way to do it. There's a different, better way, we think.
Yeah, I think that's good to know because I have 3 kids of my own. They're all a little bit older now, but I definitely would have liked to have known that this was an option because when you start having kids, you're just anxiety ridden and you feel like, what do I do? Okay, cool. I love that. So tell us why Zest or, the branch that you're in started offering autism evaluations. Why is that something that started?
Yeah. So in between coming from my traditional practice where I was before and starting with Zest, I picked up a couple kind of, positions in the interim. One of which was with As You Are, if you've heard of them before, the virtual autism diagnostic company.
I have.
So I got trained in doing virtual autism diagnostics.
Oh, okay.
So having that training and then coming into this model where now I have a lot more free time and I have a lot more say over my own schedule, we realized this huge need, not even just Northeast Ohio, but everywhere for getting kids diagnosed, right? So we have the training, we have the time. We're like, well, this just makes sense, right? Like, let's offer this. Let's partner with some local therapy companies, see if we can help them out. And it feels so good to be able to help out because, these kids, 2 or 3-year-olds waiting 18 months for an evaluation when we know the earlier we can intervene, the better the outcomes. It didn't sit well. And now that we have the training, we're like, yes, we need to do something about this.
Okay, that's awesome. So just a logistical question, because I don't know how licensures work for doctors. So it sounds like Zest has different offices across the United States. Is that true?
Correct. So we have west side of Cleveland or Westlake. We have one in Beechwood, here in Solon. We have 2 in Pittsburgh now. And we're looking to expand, hopefully Columbus, Cincinnati. But it's really finding a match of an area that will allow this to happen, just anywhere that there's kids, everywhere. And then finding the right doctor it is a little bit of a risk up front, right? So stepping away from a stable salary into here where there's not a lot of income at first. It's all, the number of patients that you get.
Right.
Once we're full though, we only need 300 patients to make more than we would make in a traditional practice.
Yeah.
So we need a whole lot less patients. But stepping away from that stable income, it's a bit of a risk for people. Not everybody's in a space where they can do that.
Yeah. No, that makes sense. So for the autism evaluations, are you evaluating people that only live in Ohio? I guess with your licensure. I don't know how licensure works for doctors.
Yep. So we need a separate medical license in any of the states that we're doing the diagnosis.
Oh, okay.
That being said, through As You Are, and one of our Pittsburgh docs also work for them too. I think she has 12 licenses. I think I'm in 16 or 18 states now.
Oh,
So we're
okay.
able to do it virtually in any of those states.
Oh, okay. Okay, that's good to know. I know, like as a speech therapist, how that works. I'm licensed in Ohio and Washington
Yeah.
State, and that's different. Okay, that's a lot of states. Okay, that's great to
Yeah.
know. So tell us what we talk about. I've had autistic adults on that talk about getting evaluated as adults because
Sure.
they just kind of usually it's a woman who maybe didn't get diagnosed. And so we talk about like how important that actual formal diagnosis was for their identity and
Yeah.
and everything, the support that they need. But we haven't really talked about like what's included in an autism evaluation. I feel like we haven't talked about that on the show in a long time. Can you tell
Sure.
us maybe what that looks like if somebody is like, ooh, I want to talk to Zest Pediatrics about
Yeah.
this. I don't want to wait in this long line.
Yeah.
What does that autism evaluation kind of include?
Yeah, so any of them should include, and ours does as well, like developmental history, right? So finding out what had been going on early on, were there any like intrauterine insults, just to get more of a backstory of the patient, because at the end of the day, they're still a human, and like we need to know about them.
Right.
And then oftentimes there's two components to it. So there's a behavioral component. ADOS is one that's typically done in person, given the fact that it needs such a standardized thing of toys and procedures. It doesn't work in a telehealth setting really at all. So we have a version of that very similar to what As You Are was doing, which is the CARS or tele-ASD PEDS, depending on the patient's age, as the behavioral component of that. And then for the kind of standardized questionnaire portion of it, we use an ADIR. So both of the components, we have like a formal standardized questionnaire that will ask the families lots of yes, no questions, describe your child. And then we go back and score it based on our standardized rubric. And we combine that with the information from the CARS and tele-ASD PEDS to come up with a diagnosis or not.
Yeah, or not. Yeah. 1 in 36 now, though. When I started in the field just over 20 years ago, it was 1 in 242. And now it's really changed. Okay. Oh, that's interesting. Okay. Because I think some people are confused about the process or scared to get the diagnosis. But we know once somebody gets a diagnosis, then that kind of opens up the door for lots more questions, like what intervention do you want to choose? And there's lots of questions. We try to answer those here at ABA Speech. But another burning question that people tend to have, and actually I do too, is how much does an autism evaluation cost?
Yeah, so we looked at kind of prices around the country and market wise, and we landed on $1,250, so $1,250 cash based. Given that we don't bill insurance through our direct care that we offer, we're not credentialed with insurance companies, so there's not necessarily that option. We have been in talks with a couple of Medicaid companies and some other insurance companies about getting them to pay for our evaluations. We're inching closer towards a resolution with some of them. So hopefully soon, based on the patient's insurance, we're able to do them through the insurance. We also have some partnerships with some of the ABA therapy centers in our area where if they're kind of referred through them, they get kind of the intake there. We can do the assessment as part of their intake. And then some of the costs can be offloaded to those centers.
Okay. Interesting. And so after somebody gets an autism evaluation, obviously you're going to so it would look like you're going to talk with the family. Are they doing the questionnaires ahead of time and then you're logging on for a certain amount of time, or what does that actually look like logistically?
Yeah. So depending on where they live too. So I'm happy to do them in person. We're here in Solon. Like if it's easier for a family to do it in person, that's completely fine. And one of the benefits too, given that there's often some coexisting, comorbidities, constipation issues, behavioral things, sleep issues. If a family decides that our model fits with the needs for their pediatric care, we usually offer like half off of the price for the family. And then, they're getting a higher level of care also for their child. But they'll reach out to us. Our website for the evaluations is zestpeds.com/autism. zestpeds.com/autism. There's an intake kind of form there. It's pretty minimal. We'll reach out to them and connect, discuss, what are the concerns, decide whether in-person or virtual is better. And then typically we can do it all in one meeting. I usually say about 90 minutes to 2 hours, at least allot that much time. go through the questionnaire, usually at the beginning, and the behavioral portion towards the end. Again, depending on the child's mood and how close it is to nap time, we might need to move that around.
Yeah, right.
But usually we can get the assessment done at that time, and then we write up the report in the next week or so. But the turnaround time we've been able to have for our families, we're not super busy with it yet. We're definitely getting busier. Someone reached out, I think, a few weeks back on a Monday. We had them in on Thursday, report in hand to send to insurance company by Friday.
Oh, that's nice.
So we can, again, because we have the time to do it, we can get it done so much faster.
Oh, that's nice. Okay. So that was my other question that I don't really know the answer to is so once you get an autism evaluation, you are then writing up a report that then parents can share with providers, insurance companies, then to get on that intervention support, however they decide to proceed.
Absolutely. Yep.
Okay. That's nice. That's great. Awesome. Good to know. You already shared. I'm going to ask you one more time to share the link. Where can people find out more about you and the autism evaluations? Because I would imagine people will have some questions and want to know if you're, licensed in their state and things like that.
Definitely. So our website for Zest Pediatrics is just zestpeds.com, zestpeds.com. From there, you should be able to access any of our different offices, whether it's the two in Pittsburgh or the ones kind of in the greater Cleveland area. And then our specific autism kind of website or landing point is zestpeds.com/autism. And it has all the information that you'll need there to at least start that reach out process. Once you submit that information, it'll go to our administrator, Dr. Hertz, who's the president of Zest. And then he'll kind of reach out to myself or Dr. Quattrone, who's our Pittsburgh doctor, who do the assessments.
Okay, wonderful. Well, thank you so much for coming on the show. It was great to connect.
Thank you so much for having me. I really appreciate it.
Thanks for listening to Autism Outreach. If you enjoyed the show today, make sure to subscribe so you don't miss an episode full of actionable strategies you can use in your therapy room. Write a review too. That would mean so much to me. I always love hearing from you. Have a specific topic that you want included on a future show? Reach out over on Instagram, ABA Speech by Rose, or visit me at www.abaspeech.org.